Tip number 3, seek feedback regularly. So you can try and get feedback from your consulting whenever you can. You're of course going to do some consultation observation tools with your trainer, but try to do some joint surgeries where your trainer is sitting in rather and observing you. When you do out of hours, actively seek feedback. During tutorials, try to practice some role plays. Video can be quite useful. If you get some consent, record a few consultations, watch them back with your trainer, but you can also then watch back yourself and pick up things like body language, some of the non-verbal cues, and any areas of weakness that you pick up, you could then ask your trainer to observe for those specifically and then try to continuously improve on them. Tip number 4, observe how others consult. Try to do some reverse joint surgery, so where you actually sit in and observe maybe your trainer, maybe some of the other team members. This can be a really good way to pick up some useful tips and good habits from experienced colleagues. For example, you might have a doctor in the team that's done lots and lots of women's health, and watching them take a history of someone who's now got menorrhagia, for example, you might pick up some tips that will help you tweak your own consulting or history. You might have another doctor who's done lots of pediatrics, and the way that they deal with children and interact with having a parent and a child in the room, the way they ask some specific questions, you could learn from that. Sometimes sitting in with a practice nurse doing an asthma clinic can give you some really good ideas about how to demonstrate things like inhaler technique, or how to explain or discuss spirometry, for example, or instructions to give to someone when they're doing specific things like taking a smear, for example.